Hello, I'm Dr. Pete and this is part 2 of our general gynae anatomy talk. If we just look at a sort of a slice through the pelvis, here we have, imagine this is the pubic symphysis right here, and here is the sacrum and coccyx here. We generally have this imaginary line that comes from the pubic bone down here to the coccyx, and then this is where things have to penetrate. There's a band of muscles there called the pelvic floor muscles and the levator muscles, and various structures have to perforate that. First structure is the bladder, so there's a urethra right here, and then that goes into the bladder here. The bladder changes shape obviously. Then we've got the vagina here, which is very closely related to the bladder, and the uterus, which is sitting here. And then we have bowel, so here's the anal canal there, and then the rectum and the sigmoid colon up there. So that's just a general overview of what's going on, but there's a few important things I want to point out. Right here, there's a little pocket there and a pocket there, and that's called the anterior fornix. I'll just write that again, sorry. Anterior fornix. And on this one here, there's the posterior fornix. Posterior fornix. Now, if we just look, there's also, here is the cavity of the uterus. This uterus is facing towards the pubic bone, so it's facing forwards, and the medical term for that is anteverted. I'll just write that over here. Anteverted, which means it's facing in a forwards direction. And if it's really kinked over a lot, so if it's really bent over, it can also be described as anti-flexed. That's an F. And so that's where you have the uterus like this, but then it's really bent right over. It's more just of interest rather than actually any sort of specific medical reason or problem with that. Now, if the uterus is facing the other way, where it's facing this way, that's called retroverted. This obviously makes common sense now. There is some logic to all this, so if it's sort of facing this way, that's your retroverted, and of course you can have a retroverted uterus which is also retroflexed, where you've got your cervix here and it's really bent over. And the canal like that. Again, there's no real particular problem with that. It's just general, like some people are left-handed, some people are right-handed, some people have a retroverted uterus, some people have an anteverted uterus. Now there's also some interesting peritoneal linings that go along here. There's a little peritoneal line that comes down here and around over the uterus. That's the general lining like that. This comes down here, sorry, up there. So this little spot here, that's called the pouch of Douglas, and that's right there. And this little bit here to fold, which comes right down, basically to almost to the cervix and over there, and that's that bit there, arrow right here, is the utero vesical fold. Pouch of Douglas is significant because some people can get endometriosis and it can collect in this area here and give discomfort. And also if there's bleeding internally, on ultrasound they may see fluid in the pouch of Douglas, so that's an important sign. And you can see that the posterior fornix and the pouch of Douglas are very closely related, so you can often, it's just very few layers of skin there. Okay. Now there are some other aspects we need to just think about for a moment. We'll go back to another view. If looking at the uterus looking downwards, so here's kind of the uterus shaped like this, and it's coming down like this into the pelvis, and there's the cervix there, but you wouldn't see it if we're looking from the peritoneal side. And in here we have sort of the rectum here, and then from the side of the uterus there is some thickening, which are proper structural thickenings, and this attaches to the very close to the ischial spines on the pelvis, and that's called the uterosacral ligaments. And just for interest's sake, there is lots of blood vessels right here. There's the internal iliac vessels and the external iliac vessels there, as well as a ureter crossing in this area as well. So the peritoneum, that's what the ureter basically is, in that area there. So the peritoneum overlies all these structures in this area here, and you've got to be very careful if you're doing surgery in that area. The uterosacral ligaments are also significant areas for endometriosis to collect, which is why I pointed them out to you. Now, other structures that help support the uterus is there's a ligament that comes off. So if imagine the fallopian tube comes off over here like this and sits back like this, there's a structure that comes from the other part of the uterus right here and goes off to the inguinal canal, and that's called the round ligament. And that goes into the inguinal canal, and if someone has a hernia, you'll see a little hernia there, and it's basically, that is the remnant, embryologically speaking, it's the same structure that turns into the vas deferens in the men, that becomes the round ligament in the ladies. So that is the round ligament. Now there's this other thing referred to as the broad ligament, and I'll just try and explain that to you now, how that works. I have to redraw. The broad ligament is not a ligament at all, it's just a fold of peritoneum. If we look at the side view of the uterus, so here's our uterus on side view again, curling around like this in a normal anteverted pattern. And here off the front here is that round ligament going off to the inguinal canal. And here is the fallopian tube doing its fallopian tube thing there. And here is a, if I just draw it in black, the ovary here with its little ovarian suspensory ligament. Then right here is a fold of peritoneum which comes along here, goes up here, around these three structures here, back down and across. And so that fold is like a sheet of glad wrap which is folded over the three structures and goes onto the uterus like this. And that fold there is the broad ligament. Now, very interesting, before I mentioned to you the blood supply to the ovary comes here directly from the peritoneum, from the pelvic side wall, from the aorta, whereas the uterine artery comes in here and curls up here. There's a collateral circulation where there's blood vessels here in the broad ligament which go through the ovary and back out there. So there's a collateral circulation. And during pregnancy, when there's a big placenta which is drawing a lot of blood supply from the heart, these blood vessels become very thick, as thick as your finger. And if ever you go to a cesarean section, you'll see next to the ovary there very thick blood vessels as a demonstration of that significant collateral circulation. That's the sort of general side view of the uterus, and that ends the talk for this session, and we'll talk about vulval anatomy next.